All right, good evening, everybody. I think we'll get started. We've got, I think, 18 folks in the room now, and we may have some more joining us as we go along. So thank you for joining us this evening. My name is Jason Doucette, and I'm here on behalf of Scleroderma Atlantic, and happy to be moderating tonight's webinar. So our webinar this evening is taking a sneak peek into a webinar series that we're super excited to be launching in the new year, with a focus on naturopathic medicine and scleroderma. The webinar series coming up next year is going to be a 6-part series led by Vanessa Cook, who is on the line with us this evening. Just a bit of background on Vanessa. So Vanessa is a naturopathic medical student based in Toronto, completed her psychology degree at Western University. Her personal journey as a scleroderma patient is the driving force behind her passion for holistic healthcare. Along with her role as chair of patient support on the board of directors at Scleroderma Canada, Vanessa also works in research with SPIN, focusing on projects aimed at enhancing the lives of scleroderma patients. She's dedicated to continuing patient-centered work, particularly in autoimmunity and women's health. Vanessa's holistic approach to healthcare reflects her commitment to making a lasting impact on individuals dealing with scleroderma by integrating personal experience, academic knowledge, and research expertise. For those of you who were lucky enough to see Vanessa at the National Conference in St. John's, this is sort of a build on from that. There was lots of very positive feedback from Vanessa's presentation, which is why we wanted to incorporate this webinar series coming up and to give you a sneak peek into what that might look like. There will be an opportunity for questions at the end of the webinar, and you'll be able to do that using the Q&A function at the bottom of the screen. And then once Vanessa's finished her talk, we'll go and pick up any questions there and then make sure that she has an opportunity to answer them. So without further ado, I will pass the microphone over to Vanessa, and I hope you enjoy the talk. Vanessa.
Awesome. Thank you, Jason, for that lovely introduction. I'm just going to start by sharing my screen here. Give me 1 second. Hopefully this all broadcasts all right. Can everyone see that okay? I don't know if Jason, if you're still on.
Yeah, we're good. No,
All good?
no. Yes, now.
Okay.
Yeah.
Give me 1 second to navigate this guy. Okay. I think we should be okay there if everyone can see that okay. I do apologize. I have like kind of split screening right now with notes and my laptop set up here a little bit, so I may not be fully looking at the screen for the entire presentation. Nonetheless, still very present. So with that being said, let's get started. My name's Vanessa. Jason kind of gave a little bit of an introduction, but today we're going to be diving into integrative approaches to managing scleroderma. And this is kind of a naturopathic approach to healthcare, and a big piece on education to enhancing your well-being. So I have a couple of disclosures before we start. Like Jason said, I work with SPIN, the Scleroderma Patient-Centered Intervention Network, the Lady Davis Institute of Medical Research in Montreal. I am also a Scleroderma Canada board member. I currently attend school at the Canadian College of Naturopathic Medicine, and this webinar series is brought to you by Scleroderma Atlantic. A big disclaimer here that this is not intended to be medical advice. It is intended to be self-educational purposes. So any information shared in this, please know that is not for medical guidance, diagnosis, or treatment, and to always consult your healthcare provider. If you have any questions or any supplement ideas, any ideas at all that are taken from this, please make sure that you contact your primary healthcare provider beforehand. So kind of my journey to naturopathic medicine. I am currently a naturopathic medical candidate at the Canadian College of Naturopathic Medicine. I mentioned I'm also a SPIN researcher with the SPIN team, and I am also someone who is a fitness instructor and someone just very obsessed with health and wellness as a whole. So I was introduced to naturopathic medicine and integrative care from a relatively young age. My mom was always kind of someone who, took me to the chiropractor, always took me to a naturopath. But it wasn't really something until later in my life that naturopathy would play such a vital role in my development and ultimately be the reason why I'm here today. So when I was in my second year of university, I was diagnosed with scleroderma, and you can imagine the identity crisis that this caused. I was 19 years old, trying to navigate what this meant long term while simultaneously trying to figure out kind of what my purpose was in this life. So the diagnosis did not come easy, not for me, not for my loved ones, not for my friends or family, but surprisingly, my purpose kind of did. So naturopathic medicine became a way that I could feel in control of my disease. And I became very obsessed with how the career can help others. I also became very inspired with how people with living with scleroderma had their own experiences with holistic healthcare, and how it kind of helped them along the way too. So naturally, I set on my way to become a naturopathic doctor, and I'm currently in my third year of naturopathic medical school. So for a webinar breakdown, we did originally have this for November. It's now December 2nd now. So we have our introduction for naturopathic medicine. In January, we're going to be taking a deep dive into diet. February, more looking at gut health and scleroderma. March, managing pain and fatigue. April, we'll be understanding hormonal health and scleroderma. And then in May, kind of doing a full wrap up of everything. How can we take these long-term strategies and make them into sustainable habits? So with understanding scleroderma, we know that scleroderma is a rare chronic connective tissue autoimmune disease. And since this is a chronic pathology, it not only impacts our physiology, but also our day-to-day, which constantly changes and evolves as we do as people. So since this is an incurable disease, conventional treatment typically focuses on symptom suppression through medication. Now, this will never ever be a knock on conventional medical care at all, as it is completely necessary in managing the disease for many people. Now, with that being said, since this disease is incurable and lifelong, there will always kind of be gaps within conventional care. So naturopathic medicine is kind of meant to act as an adjunct treatment to fill those gaps, honoring that we are whole people, we all have very different individual lives, and kind of honoring that we're treating that whole person, stretching into every period of someone's life. Now, to move on to stress, stress is a very broad term. So how can we kind of break this down into physiological stress and then also external stress? So I don't know if I have the chat function on here, but maybe to yourselves, or you can mention it in the chat if it is there. Has anyone kind of heard of the biopsychosocial model before? Give maybe everyone a second to say yeah or no. Don't know if there's a chat going. I can't necessarily see it, but to yourselves, maybe yes or maybe no. So if we're breaking this down, biological stress or physiological stress is the actual stress and inflammation caused due to potentially the autoimmune disease on a cellular level. So we have that physical health, our genetic vulnerabilities, drug effects, etc. And our external stress, such as social stress and psychological stress, is the stress and resulting inflammation caused by factors kind of outside of us. So, maybe you have an argument with a peer or family circumstances, different relationships. Maybe your physical health is now entering this as well, your coping skills, all of your social skills, kind of these things that are more external to us, how we internalize that and how that mitigates stress in our body. So as I mentioned, this could range from kind of the fight you had with a loved one, the heavy workload you have at your job, maybe the food sensitivities you're ingesting, maybe it's the environment that you're in, or you had a heavy metal exposure, or even mold growing in your home. So all of these things we kind of take for granted, and they can 100% worsen our symptoms, let alone our scleroderma symptoms. So naturopathic medicine really aims to target all levels of a disease exacerbation, whether it's, that tiny fight that you had with a loved one to a really big thing going on with our disease. We kind of want to cover all pieces of that. Oops, sorry, I'm going back here. Okay, so going into naturopathic medicine, what is a naturopath? Again, I can't see the chat box here, but if anyone has seen a naturopath, kind of just keeping that in mind. If you have or haven't seen one, if you know what one is, if you don't know what one is. So naturopathic doctors are registered. They are registered to attend a 4-year post-graduation naturopathic medical school. So we are trained to diagnose and treat conditions through natural and traditional therapies, also biomedical perspectives and pharmacology, which I feel like a lot of people don't know. In certain provinces, we have our prescribing license. In Ontario, we don't, but we always get trained in that pharmacology aspect in case our scope widens one day. We also get trained rigorously in diet, lifestyle, physical modalities, and all to kind of treat through a root cause perspective. And our philosophy is to, again, support the whole individual through a very individualized approach, focusing on the root cause and to build health integrity into other areas of one's life. So what does naturopathic medicine have to offer you as a scleroderma patient? So naturopathic medicine provides a very personalized approach to health, acknowledging that we are all different people and that we require and respond differently to treatments. Natural therapies can also fill as that adjunct in conventional medical care. And then we are also huge in prevention and optimizing health. So you don't have to just feel okay or kind of within that reference range. We actually want you to feel good and as good as your body will allow you to feel. So as I mentioned, kind of our core pillars are diet and nutrition, supplements and botanical medicine, lifestyle approaches, pharmacology, Eastern perspectives, including traditional Chinese medicine, health psychology, and physical medicine, which I'm going to kind of give a little bit of a deeper dive as we go into this topic. So before we actually get started on the therapeutics, I want to go over some key principles in treating scleroderma so that we can kind of look at how naturopathic interventions can help people living with scleroderma by looking at all of these different pillars. So my first concept here is oxidative stress. I'm not sure if anyone has heard of that. It's a pretty common term that's kind of thrown around. I want to break down what that actually means. So our bodies make harmful molecules called reactive oxygen species, so ROS for short. And in scleroderma, to basically kind of put it into lay terms, there's too much of them. We have way too much ROS going on in our body. And the ROS attacks healthy cells, damaging proteins, DNAs, and fats. And the damage triggers something called fibroblasts, which are cells that make collagen. I'm sure as we hear the word collagen, that's kind of setting off brainers. We all know scleroderma is kind of that overproduction of collagen. So the damage triggers these fibroblasts. They go into overdrive and ultimately kind of worsen that disease. So not to further complicate things, but there are other factors such as alcohol, stress, other things that can kind of trigger our body to make these harmful molecules. So you can see where naturopathic medicine may be able to play a role in this. We often use antioxidants, which we get from berries, our dark leafy veg. You can even supplement with different antioxidants too to kind of combat those free radicals, that reactive oxygen species in the body. And we want to look at how, as naturopaths, we can honor that and kind of decrease this process going on for people living with scleroderma. A lot of big terms also too. I apologize. I swear we'll wrap this all up in a great way. So my second and third concept here is chronic inflammation as well as tissue remodeling and fibrosis. Again, those might be some terms that you might have heard potentially with your diagnosis in scleroderma. So with chronic inflammation, the immune system is essentially switched on in scleroderma. So it's like an alarm bell that won't stop ringing. So cells release too many inflammatory signals that fuel tissue damage and fibrosis. So we're getting kind of that thickening of the skin, the thickening of the scar tissue in the body. So this ongoing inflammation becomes a cycle and ultimately makes the fibrosis worse. So in scleroderma, the excess collagen stiffens our skin, organs, making them hard and less functional over time. So the tissues kind of lose their natural normal structure and causes long-term damage. So I always like to use the idea of, if we hurt ourselves, for instance, here you can see a harmful thing enters the body, we get pain, swelling, redness, warmth, and these are actually not necessarily bad things. We get inflammation as a good thing to help heal ourselves. So we start kind of producing that, and we get collagen and a scab forms. However, in scleroderma, I always use the idea that scab forms, but then the body's saying, produce more, produce more, produce more. It's almost as if there's a continuous cut on the body and we're producing too much collagen, is what kind of happens. And that cycle you can see is a pretty what's the word? I was going to say tedious one. Tedious is not the word, but the cycle keeps going on, and we see that in scleroderma quite often. Also want to ask a question here again too. Can't see the chat box, so I will just say, who here suffers from Raynaud's? I'm sure many of us are thinking to ourselves, I know this, I suffer from Raynaud's. I know myself, I suffer from Raynaud's. So I'm sure many of us are very familiar with vascular dysfunction. So in vascular dysfunction, the blood vessels in scleroderma are damaged early on. So our endothelial cells, which is that vessel lining, starts dying off. And this leads to our poor blood flow, causing symptoms like Raynaud's, as well as those ulcers that we commonly get on our hands, feet, our joints even. And our vessels cannot properly dilate because there's too much of a tightening signal that we have, and then not enough of a relaxing signal. So those were kind of the key concepts. I know that was a lot of words. So I kind of want to get into the therapeutics and where can naturopathic medicine kind of intervene at many of these pillars. So let's start with one of my favorite topics, which is diet and lifestyle. This is actually my favorite topic to speak on, so I'm really looking forward to our next session as well, because I know how much food can have a role in kind of helping people with scleroderma, and also because I'm a huge foodie. Admittedly, I love food, I love cooking, I love eating food, I love everything about it. So with that being said, why does this actually matter for people with scleroderma? So scleroderma is an inflammatory disease, and this often comes with a lot of GI concerns and sensitivities. I'm sure many of us are very aware of that. So what you eat can further this inflammation and influence your gut health, energy, GI related pain and discomfort. So therefore, optimal food choices can combat that oxidative stress that we were talking about earlier in the body, modulate immunity, and also make your body more tolerant towards adversities. So let's break this down into a couple of key players for people living with scleroderma. So for systemic and cellular inflammation, we want to optimize those omega-3s. And that generally comes from kind of like fatty fish, white fish, seeds. Nuts are often very high in omega-3s. You can also supplement with it as well. Other ingredients such as ginger or the active ingredient in turmeric known as curcumin can aid in joint and gastrointestinal inflammation. For cell protection, which is pretty huge in scleroderma, we want to talk about our antioxidants. So again, going back to those reactive oxygen species floating around in our body, how can we use antioxidants to kind of neutralize that process? So we want to think of everything that you think is healthy and maybe kind of boring too, but your berries, your dark leafy vegetables, nuts, citrus fruit, kind of everything that you imagine is healthy is generally has some kind of antioxidant component to it, but especially, your berries, your dark leafy veg. And then also for gut support, we're utilizing pre and probiotics that come from food. So you can think of your sauerkraut, your yogurt, kefir, kombucha, kimchi, miso, and tempeh. It's anything that's fermented in nature generally has some kind of pre or probiotic portion to it. Now, also going into this without touching too much on it, because we will in our next session, but I cannot express how important protein is for scleroderma patients. I actually was recently asked by my chiropractic doctor when I said I was doing this talk about what they thought the most important thing that if I could convey to someone with scleroderma, what I think is a really important concept, and it was tied to this, and that's that when people living with scleroderma, go through different stages in their disease, their protein requirements change quite a lot. So there are two different ways in which muscle synthesizes and supports itself in the body. So that's through two processes called anabolism and catabolism. So in a catabolic state, your body is breaking down amino acids from your muscle tissue in order to support itself and give the body energy. In an anabolic state, your body is utilizing dietary protein to build muscle. So in an anabolic state, that is ideal. We want to be eating chicken and then using that for energy. However, sometimes if we're in a heavy disease state, or maybe we're not eating enough dietary protein, our body's going, where am I getting energy from? I need energy. So it's taking it actually from the muscle tissue. And that can sometimes lead to muscle wasting, more fatigue. Our body is working off itself to kind of sustain itself. So how can we utilize dietary protein to help ourselves when we're in a flare, when we're in a higher portion where our body is needing more protein? And then also a massive part here too is people with scleroderma, how are we supporting ourselves in terms of fatigue and energy, but also absorption? So, it's one thing for someone to say, oh, eat more protein, eat more protein. That's great and all. And it's fantastic if you can. But for a lot of people living with scleroderma, the fact is we can't actually always digest and absorb all of that protein. So how can we prepare our food so that we are actually absorbing it? Are we making it in soups and stews where it's more broken down? Are we having smoothies again where it's broken down? It's more in a form where we can actually kind of uptake that protein and utilize it? Or are we supplementing with protein powder is a fantastic way as well too. So this is a topic that, again, I could probably rant on and on and on about it for a very long time, but nonetheless, I think it's something that's really important and something that needs to be stressed in scleroderma. Now, with that being said, I'll get off my soapbox about protein. We can also talk about how fatigue and energy can be supported with blood sugar balancing. My other topic with diet and nutrition too is that anti-inflammatory and whole foods diets are very beneficial ways of eating. They are extremely well documented diet patterns that can be very beneficial for almost anyone. So your focus is on whole foods, so fruits, dark leafy vegetables, healthy fats, and lean proteins. I also like to throw in, like I was mentioning, that scleroderma patients have a harder time digesting food. So cooking your vegetables in soups, stews, baking them, maybe frying them in a frying pan with a bit of coconut oil too, something to kind of break it down a little bit so we have an easier time to actually digest it. And then also, as I mentioned, blood sugar balancing your snacks and meals and optimizing your protein intake, especially when you're going through a flare. So blood sugar balancing would just kind of mean, if you're having something that's a little bit higher in starch or higher in carbohydrates, so we're having pasta, maybe adding chicken to our pasta, adding some fiber to our pasta is a great way to help our blood sugar levels stay stable throughout the day. And again, another topic that I will go more into with our next webinar. Last part here too is this is what we can kind of add in to support ourselves. So adding in that protein, adding in our healthy fiber, and what can we actually avoid as people living with scleroderma? So avoiding processed foods, refined sugar, excess alcohol, reducing excess caffeine as it can be inflammatory and actually trigger our Raynaud's. So I will never be the person who will ever tell you to not drink your daily coffee if you really enjoy your coffee, but maybe limit it to 1 or 2 cups a day. Just because we do know that caffeine can have a vasoconstricting effect, so making our Raynaud's worse. And then also avoiding sensitivity. So people with scleroderma are generally sensitive to a food group called FODMAPs. These are a group of short-chain carbohydrates that are poorly absorbed in the small intestine. So this can cause some digestive discomfort in some people, especially those who have conditions such as IBS, maybe IBD. In scleroderma, also, I'm sure many of us know, we have a harder time with nightshade vegetables, so tomatoes, eggplants, pepper, caffeine, again, which causes the vasoconstriction. So with that being said, just being very mindful of, do I have a harder time digesting a food, and is it making me inflamed? Is what I would say. A good part with this too, or a good practice to do, I would say, is always keeping a diet diary if you haven't done one yet. So I would say you can do this over a span of a period, but tracking kind of what you ate in a day, obviously very non-judgmentally, but just noting if you had symptoms throughout the day. Maybe noticing if you had symptoms the next day, if you ate something, or if you're noticing that you get discomfort with one specific food, you can kind of look at it and use it as a diary to tailor, okay, I ate eggplant on this day and then I noticed I was inflamed Monday, Tuesday, Wednesday, or I ate this and I felt completely fine, but then the day after, sometimes it's really hard to nail it down. So having that diary helps us to kind of look back and actually see, what could have been triggering in our bodies. Think that was all I wanted to say for diet. Oh, I guess last part here too. I'd kind of talked a little bit about omega-3s. Omega-6s are kind of the bad omegas in our body. Those are what can cause inflammatory issues for us. So avoiding, again, I think I mentioned this, but trans fat, processed meats, that's kind of your deli meats, pepperoni, fast food, etc. Anything that has seed oil, so high in canola oil, sunflower oil, etc. Prepared foods, already fried foods, definitely just checking your labels and becoming kind of acquainted with, what are good fats and what are bad fats for us. So good fats, those omega-3s, that fish, your fatty acids, nuts, seeds, legumes, etc. And omega-6s, kind of those fried foods, getting acquainted with those terms and looking at your labels as you go grocery shopping. So heading now into supplementation. So supplementation, as I mentioned before, is a big tool in a naturopath's toolkit. So we often use supplementation for health optimization. We have many different supplements. I'm not sure if anyone has maybe even used some of these in the past before, or has maybe heard of them. NAC is a pretty powerful antioxidant. It's actually a precursor to glutathione, which is something that is generally lacking in people living with scleroderma. Vitamin D, which I'll go a little bit on further in the presentation. Omega-3s I had mentioned. Curcumin, that active ingredient in turmeric. Probiotics, I'm sure many people have heard about. So again, these are just some of the common supplements that I often see, especially online. ECGC, which is a green tea extract. These are some of the things that we often use to treat people living with scleroderma, but also just general population as well. Now, I kind of mentioned this as well too, but supplementing for health optimization. This is specific for people living with scleroderma, but how can we kind of support that gut and immune function with our supplements, potentially our muscle function, relaxation, and sleep. We know that sleep is a huge thing for people living with scleroderma. Again, combating that oxidative stress, and then just reducing stress overall in the body. There's also that lifestyle aspect that naturopaths like to work with. So kind of, again, tailoring this to people living with scleroderma. How can we manage our gut health? Incorporating fiber-rich foods, maybe repairing the GI tract with something called glutamine, which you can take as a supplement, or you can also get it from different foods, such as bone broth, and just protecting our gut lining, as many people with scleroderma have a lot of GI dysfunction. For physical activity, how can we use resistance training to combat joint stiffness as well as bone loss as we age? For stress management, we can use something called adaptogens. Again, too, not sure if anyone's familiar with that term. I don't know. There's one supplement called ashwagandha that gained a lot of traction within the past couple of years. And that's kind of an example of an adaptogen, not saying that's necessarily meant for people with scleroderma, but just an example of one of the things that we can use to kind of decrease our stress. There's lots of different supplements and lots of different approaches that we can use here. Even we do a lot of meditation. I know that sometimes sounds a little bit woo-woo, but getting that mind-body connection, we really want to honor that. And it's very individualized to what someone may need. Looking at how we can protect our skin from the sun, as well as reducing our routine with endocrine disruptors. So those are things that kind of disrupt our hormones. And how can we maybe remove them from our current routine in life, or identify them and remove them and see if it makes a difference. And then again, coming full circle back to, what does the individual need? What is triggering this individual? And how can we help them? There's also a lot of different Eastern approaches. I mentioned this too with the traditional Chinese medicine. This was something actually, as I went into school to be a naturopath, I actually had absolutely zero idea that naturopaths were trained in this. So we have a considerable amount of hours in acupuncture. So that's when you place like the fine needles into the skin. I'm not sure if anyone's maybe had it done for pain relief. Or kind of the traditional medicine way of honoring the whole body. But we get a lot of training in that, and it's something I love to use for pain reduction. We also get training in Chinese herbs, moxibustion, cupping, Tai Chi, looking at spiritual well-being, and then also the TCM diet, which I think is something really cool. We kind of look how we can make a meal more nutritious and beneficial for the whole individual. TCM is really big on kind of cooking our foods, and I think that's a really good sentiment to being a scleroderma patient and looking at the TCM diet, because it's a lot of foods that kind of align with people who live with scleroderma and how it can help us. Now, going into another big topic here. So we have pharmacology, we have drug side effects, as well as interaction. So many people living with scleroderma often have medications or take medications that interact with various nutrients, impacting our overall well-being and health. So it can potentially affect the absorption, metabolism, and overall balance of different nutrients in the body. So some medications may actually inhibit the absorption of specific nutrients, leading to deficiencies, while others may actually affect the metabolism, impacting their effectiveness, and then eventually leading to imbalances. And additionally, certain medications can deplete nutrient levels or interfere with the body's ability to actually utilize them properly. So these interactions can have significant implications for health, making it crucial to monitor our nutrient levels or potentially adjust our dietary intake or supplement as needed, again, in consultation with a healthcare provider. So just a couple of common scleroderma medications with some of the interactions they include. We often see with antibiotics, this is a pretty common one. I'm not sure if people are familiar with this, but antibiotics can impact gut health as well as immunity. Generally, when you're given antibiotics, they'll sometimes tell you to take yogurt, which are very high in those probiotics. So if you think antibiotic, we have a probiotic. One's kind of canceling out the other. One is killing the bad bacteria, which is completely necessary, and one is promoting that good bacteria. So how can we find a balance between the two and support our gut, especially for people living with scleroderma who may have low motility or issues with digestion regardless? Another one is ACE inhibitors can potentially deplete potassium and zinc. Immunosuppressants such as methotrexate actually inhibits our body's ability to absorb different nutrients, specifically folic acid. So I have seen previously that when people are on methotrexate that they are prescribed folic acid, which is fantastic, because we're combating that already, and the importance of taking that folic acid, because it's very beneficial to our overall health. We have our NSAIDs such as Tylenol and Advil also affect our gut health, as well as potentially deplete the folic acid. Calcium channel blockers, which deplete magnesium as well as vitamin D. Corticosteroids, which interfere with vitamin D, C, B6, and beta carotene. And proton pump inhibitors having an effect on vitamin B12, B1, thiamine, and beta carotene. Now, these are just a few examples, as there are many more that I could include here. And studies have also varied, but on the high end that I have seen in studies, autoimmune patients with a vitamin D deficiency is estimated to be about 80%. So that's a huge percent of an autoimmune population base that have a vitamin D deficiency. So moral of the story here is kind of just keeping track of those nutrient deficiencies, and knowing that you potentially may have them and that they can be fixed via diet or supplementation, and then ultimately help with alleviating those symptoms. So knowing that these medications are very life-saving and impactful, but how can we kind of help ourselves too? How can we add in maybe vitamin D supplementation or folic acid, or using those antioxidants from our diet to actually not just have us feel better, but help us feel great. Now, I'm sure we are all aware, but medication can have a lot of side effects. And I would like to say, too, that there are always a lot of very safe naturopathic interventions that can assist with these side effects. So this is just a few very common ones with scleroderma. But for nausea, we often prescribe high-dose ginger supplements. And as a side note, too, this is super random, but ginger is very extremely effective with managing menstrual cramps. And in addition, we can use nausea and use herbal teas and tinctures that may be better tolerated for people living with scleroderma if the ginger tends to be a bit too much or a bit too acidic for people. For bone loss, also known as osteoporosis, we recommend resistance training and supplement with vitamin D as well as calcium. For fatigue, we do adjustments in diet as well as the use of adaptogens to help the body cope with stress. So that was kind of those adaptogens I mentioned before, the ashwagandha, L-theanine, these kind of things we can utilize depending on the person to help promote a bit more longevity and energy. For skin irritation, we look at vitamin E, omega-3s, hydration, and prescribe balms and salves. For muscle weakness and cramps, we look at magnesium, electrolyte balance, hydration, and then GI concerns. We will probably look at diet as well as potentially probiotic use. There's also a lot of different things that we can kind of use to line the GI tract so that we're not feeling uncomfortable or experiencing that bloating, indigestion, etc. I also like to give this story. I told this story at the national conference as well, but one example of using a supplement to kind of, help alongside conventional treatment was I had a really, really bad staph A infection in my finger from scleroderma. My finger just continuously was getting infected. It was actually an ulcer. The ulcer kept getting infected. And I was on rounds of countless antibiotics. So, my gut was not feeling great at this time, I will say. I was not doing too hot with things. I kept getting this infection. It was really, really poor. And it wasn't until my naturopath had recommended using castor oil with oil of oregano. So oil of oregano actually has really wicked evidence for being extremely effective against staph A infections. So I was using this topically on the infection. Now, obviously, again, this is never medical advice. Please always talk to your doctor before you use anything. But using that in combination with the antibiotics, I was finally able to clear the infection. So again, just the moral of the story is how can we kind of use these interventions that we're given, but have these small tidbits that we can use to empower ourselves and help ourselves feel better faster. Now, heading into I believe this is my last slide here, but other beneficial modalities for people with scleroderma is hydrotherapy. So we use this for Raynaud's circulation, stiffness, and immune support. And hydrotherapy, I don't know if anyone's ever seen this. It's never not never, it can be the extremes of, you see people do cold plunges and then go into a sauna. And sometimes it can be that, but for people living with scleroderma, it doesn't always have to be that. Maybe it's using a hot pack for 15 minutes a day, 3 times a day, or, doing that cold contrast, but at a very low level. And how can we kind of promote circulation and reduce stiffness by doing that? Again, also using that mind-body connection, our meditative and mental health practices, as well as physical medicine. So we do a lot with pain management too. So there's the soft tissue manipulation. If anyone's seen a chiropractor too, we're also trained to do those manipulations as well. Cupping is a really huge one. Acupuncture is also really big for this. Assisted stretching, release. We're even trained in massage too, which is something that I didn't know before I came into the program. So these are all, again, little tidbits that naturopathic doctors can use depending on the person and what they feel is necessary. And I believe I'm coming to the end here. So thank you all so much for listening. This is a topic that I am so extremely passionate about. I would also like to thank Dr. Sean McConnell. He is the naturopath who helps supervise and will be supervising these next couple of webinar series. I would love to take any questions. I know at the conference there was a lot of questions, so maybe pass it back to you, Jason, or I'll stop sharing here.
Sure, that's awesome. Thank you. Lots of great information there, and I know everybody's looking forward to sort of delving into a lot more detail into the future sessions coming up too on each of the individual topics. So that's awesome. A really good overview tonight in terms of what we can expect. So that's exciting. It's good. So happy to have you with us. As a reminder, folks, you can ask your questions using the Q&A function on the bottom of your screen. So there's a little Q&A button down there. You can pop your question in, and I will have Vanessa answer it for us. And we do have our first one, so I will go ahead. So the first question is acupuncture helpful with gut issues?
Sorry, I was also looking at the chat here. Thank you guys so much for coming to. It always warms my heart that people are interested, because I could go on a tangent about any of these topics for 100 years. So to get to the question, yes, I would say definitely a lot of times there's kind of this mind gut connection. I don't know if anyone's familiar with the HPA axis, but kind of, how can we calm the mind to also get to talk to our gut, and then our gut to talk to our mind? And that sounds really silly. It's a silly analogy, but we do have so many neurotransmitters that go in between our gut. So if we can kind of both calm our mind, but also calm that visceral area surrounding our gut. I've seen a lot of times naturopaths will do local acupuncture, so acupuncture directly on top of the GI tract, but also full body. So I would say yes, there's definitely limited evidence in terms of acupuncture and gut issues. However, in my practice and at our clinic, we use it all the time for people who might have issues, especially motility issues, a lot of constipation or diarrhea. They do the acupuncture. In adjunct, they'll maybe prescribe probiotics and do other things as well too. But yeah, thank you. That's a great question.
That's awesome. Next question, and in addition to the person saying thank you was wonderful, looking forward to the next sessions. They're also asking if you could describe moxibustion. Hopefully I pronounced that right.
Yeah, moxibustion. This was really cool. So something that I learned how to do myself recently within the past year. So I don't know if you're familiar with cupping. It's kind of like that suction and it's pulling that fascial tissue up into the cup. However, moxibustion is actually used with fire cupping. So they put I want to say a fire and a light. That's not it, but you light a Q-tip or light some kind of flammable thing, put that in the cup, and then it'll do the same sucking action there too. They'll also use different Chinese herbs and warm it and put it over potentially the issues. I've seen this done with ulcers. I've also seen people do this with different GI concerns too. It feels really nice, I will say, just locally having kind of something really warm and warming. It feels as though it warms deeper than just the tissue. It feels as though it's going quite deep, which is nice. So that's a little tidbit on moxibustion, but thank you for the question.
Next, can you review what you used for finger infection? Oregano and
It was oregano oil, and that's known to be very antimicrobial against Staph aureus infection. So you always have to use it with a carrier oil, something like oil of castor oil or potentially even an olive oil if you tolerate it well. Like I said, always talk to a naturopath too if you have an infection yourself, just because sometimes it can be a bit irritating to the skin. But I was very shocked when I did my own research on this too. I was like, oh my gosh, there's so much evidence for this, and I can't believe it's the first time I've heard about it. So
Awesome, good tidbit. Any other questions for Vanessa? Oh, okay, yes. Thanks for a great presentation. Could you explain a little more about that TMC diet or where we could find more information on this way of eating?
yeah, okay, I love that. I love that you guys are interested in this too. So TCM really honors a lot of digestible foods. To kind of put it into lay terms, because the way they explain it can be very complicated. But they want foods that almost strengthen your spleen and your stomach. And it doesn't actually mean like, your physical spleen. It's their way of kind of saying, how can we embody the whole person and help with digestion. So a lot of soups, a lot of different Chinese foods, potentially like yams, nutritive foods, foods that kind of give us a bit more substance in the body without having that toll of digestion. In terms of resources, let me get back to you because I don't actually have one on hand, but I'm sure that there's quite a few. Maybe let me see who asked that, because I can email you after this I'm sure I can find a couple of our resources to send to you. I don't have one offhand, but I would love to send one to you. That was Carrie. Please email all of us. Okay. I will send an email. Or maybe Jason, can I send
Yeah, we
that to
can,
you?
yeah, we'll coordinate that.
Okay, I would
Yeah.
love that. Give me a day and I'll double check with my other naturopaths too, because I'm sure they have wonderful resources as well. But TCM's a really cool topic that I love to talk about. So it's good to know.
Okay, perfect. Think people are paying attention. It's great.
Yeah, thanks guys.
So Nathan's asking, I've been using NAC for over a decade for my lungs. It apparently helps with secretions, and I always notice when I forget to take it for a few days. Thank you for reiterating its importance, and really appreciate your presentation.
Yay. Oh, that's great. I know. I love NAC. I take it because it's very mucolytic. So it means it's when you're stuffed up, it kind of gets rid of that mucus and thins it out. So I can imagine for your lung issues, it can be beneficial. But I find too when I don't take it and then when I do take it, I'm like a new person. I'm like, oh wow, I actually can breathe again. So yeah, that's a good one. And thanks for sharing that too. It's nice to hear when people have used different things.
And somebody asked, so you mentioned Tai Chi as one of the skills for naturopaths. Is this something that's good for people with scleroderma? And I just also want to say myself personally, I had no idea that you guys are trained in so many sort of extended medical health
I know.
massage and all of it. That's awesome.
Yeah,
I did not
yeah.
know this.
It's
That's great.
like I said, it's something when I came into the program, I was like, oh my gosh, I didn't realize I'm going to be needling people this much or giving people shots or taking their blood and, doing all of these random things. But I think it kind of makes a profession
But from our side, yeah, it's very good to know that, right? Because I
for
had no
sure.
idea. Yeah, that's good.
Totally. Um, Sorry, that was on Tai
Sorry, Tai
Chi.
Chi. Yes.
Yes, I got distracted on that.
Sorry, that was my fault.
Yes, Tai Chi. I would say for people with scleroderma, I love Tai Chi as a low impact moving exercise. So for people who have limited mobility, like people with scleroderma, I love it. Like I think that's a really fantastic. Another really good exercise intervention that I do like, depending on if you can tolerate it too, is always swimming or something in the water. Again, if you can tolerate it, I say that very specifically because I know when I go in water for too long, my Raynaud's goes crazy. But these lower impact exercises, and you can always do a quick Google at what other interventions there are for low impact exercises, and we'll touch on some of them too in the future. But Tai Chi being one of them, I love that for people who have limited mobility and kind of want to maybe do some slow movement that isn't too strenuous.
Perfect. Next question. When we're on PPIs for a long time, what helps to balance the effects?
I think the biggest one here is stomach acid. I think it's pretty person dependent. So it depends how well you're kind of tolerating your PPIs. Balance the effects. Maybe let me get back to you on that one, Denise, because that's a good question. I do want to say it's quite person dependent, but maybe let me get back to you and I'll look into interventions for that one.
Any other questions?
Okay,
more people
PPIs.
interested in
Okay, don't
PPIs
let me
here.
forget this. PPIs and then TCM diet. I will do some talking around just to double check. I have my ideas, but I want to cross-reference that they're correct. B vitamins. Yes, B vitamins can be beneficial. I'm trying to think of what slide I had up here with this guy. Oh, yes, that it can have an effect. So this doesn't necessarily mean that supplementation with the B vitamin, I believe it depletes B1, B12, as well as beta carotene. So it just depends. It depends how long you've been on it. Depends if it actually is depleting it, because it acts differently in people. You know, some people might take a PPI for a long time and not actually end up having those nutrient depletions, whereas some people might. So like I said, it's pretty individualized. With that being said, B vitamins are always relatively safe to take. A B complex is pretty easy to get as well, very safe and very effective in terms of energy. Again, not saying that it kind of cross-references the balance of it, but that can potentially be something to look into for sure. Thanks, Denise.
Any other questions? And while we're waiting to see if there's any other questions, just a note too for folks that so recording of the webinar will be posted on Facebook and on our YouTube channel. Stay tuned to our social media too for more details on when the webinar series will kick off in January. We'll have the dates and everything lined up there, so really looking forward for that. Let's give it another second or two. So I think we're good. So on behalf of all of us at Scleroderma Atlantic and everybody online, thank you, Vanessa. That was awesome. Lots of great information. Really looking forward to the series kicking off in January. I think it's going to be great. Lots of positive feedback so far from the chat and Q&A, so that's awesome. So really looking forward to it.
Awesome. Yay. Yeah. And just to say again, thank you guys so much for having me. Like I said, as a scleroderma patient myself, this is something that I get really excited about. And I'm so passionate to share what's worked for me and what's worked for other people and what the evidence says and everything too. So thank you, Scleroderma Atlantic, for having me and for hosting this. And I'm really looking forward to seeing you guys in the new year.
Sounds good. Take care, everybody. And we're getting into December, so happy holidays as we get closer to the end of the month. Have a great night, everyone. Thanks for joining. Bye-bye.
Take care.